I'm sitting over here on this computer, but I'm getting your questions together for our next guest. It's Dr. Daniel Nickles, and he joins us to answer those dental questions because you are the dentist that we see on TV advertising. Are you too afraid to go to the dentist?
Right.
So if they're too afraid to get to you, they probably have questions they've not ever asked you.
Absolutely.
Is kind of what we're thinking with that. So I will be sitting here looking for those questions, but I want you to tell people a few of first of all, where you are, where they can find you. Yes.
We celebrated 22 years at Lake Forest Shopping Center Monday. So I moved in there temporarily 22 years ago, and we just stayed. It's been just a wonderful place to be. And they give us a call at 244-3211.
Okay.
And, actually, my girls are there now. Even if you want to call and ask them questions, they're available.
Do they still have the dance studio down there?
That's dance still.
When Kimberly was 5 years old, she took dance from that dance studio. I know exactly
Palmer
where you're
School,
located.
right? Still there.
Small world. So we already got some questions coming in. Is it okay to apply hydrogen peroxide to someone's teeth to bleach them? If so, does it work?
Yes and no.
Okay.
Okay. The strength of hydrogen peroxide that is available to the public is only 3%, and it's really you would have to almost hold it in your mouth all day long. The stuff that we use is a higher percentage, and that's why we make the trays or through some of the strips. It's the actual amount of time that it actually contacts the tooth, and you want it to contact the tooth and not the gingiva, because if you contact the gingiva or you place, I've seen people try to do it at home. I've actually had people come in with white gums. They actually have bleached their gums.
Their gums.
Leave that to us. We'll take care of that. Today with the strips, it doesn't cost as much as it used to. They're a lot more effective, and it's a lot safer for the patients.
Okay, all right. And so the next question is for someone that needs fillings and a cleaning, but doesn't have any kind of insurance, what would be the best and easiest way about going to get it done? And inevitably, every time we have a dentist on, and I know the dentists in your practice take insurance.
Right.
But do you have advice for people who are out there that don't? Because I get that question every time.
Right. The best thing is, give us a call at the office, and we'll get you and we'll take x-rays. We'll show you exactly what you have, what we need to do, what we can do, and we'll find out whatever, your desire is. Probably 50% of my practice doesn't have insurance. I mean, unfortunately, through the years, a lot of insurances have become where they're just not, feasible to have, and so some companies are dropping them off.
Even some dental insurance is barely there.
a lot of dental insurances aren't even have. The sad thing is, the dental max in 1972 was $1,000. The dental max in 2013 is about $1,000 still. I mean, you can't get anything.
And that's not the same $1,000. We all know that.
Not at all.
We all know that. Okay, let's get some more questions in there. On that same line, do you take Medicaid?
We do not take Medicaid.
Do not take Medicaid. Okay, so we have that question. Can and will you see? Oh no, we already answered that one. I'm so sorry. So give us some advice on good dental health. If there's something that people need to do day to day, what do people neglect to do?
Honestly, brushing and flossing, just basic preventative care. If you brush and floss your teeth, after you eat, I've heard this thing of, I just need to brush my teeth once a day. Once a day is great. You should brush your teeth, back in the day, after each meal, any in between snacks, brush your teeth. Food will collect on your teeth.
I have a phobia about going on TV without my teeth brushed. Cindy is laughing because a lot of times I'll be right back, I gotta go brush my teeth.
Yeah.
But the more, you can't brush them too much, I guess.
You really can't brush them too much.
Losing family time over it or anything.
Use a nice soft toothbrush.
Yeah.
And brush and floss. If you just brush alone, you're missing about 40% of your teeth.
Okay, here's the last question. And it came from these guys over here. Dr. Daniel Nickles, thank you so much. These guys over here. Dan, can you show us those guys? Because this dental question came from them. They want to know, what does moonshine do to your teeth?
Moonshine do to your teeth?
He's blushing.
I don't know, but I'd love to find out.
All right, that is what's coming up on the show. We've got those famous boys from the Discovery Channel, right? Yeah. We're going to talk to the moonshiners coming up.